Hello, my name is Tuka Zokai. I am a fellow with the American Institute of Dental Public Health focused on health equity, and today we are going to talk about the COR Syndemic and its impact on veteran oral health. COR stands for COVID-19, opioids or substance use disorders, and racism. A syndemic or a systemic epidemic is an aggregation of two or more concurrent or sequential epidemics or disease clusters in a population. Currently, we see that there is a syndemic that is interacting in the United States population regarding COVID-19, opioids, and racism. However, the oral disease epidemic is also interacting with the COR syndemic. And ultimately, all four of these together decrease the health of a population, especially vulnerable populations. We see this with veteran populations and their decreased health due to the community not addressing the COR syndemic and how that then influences their oral health. As an overview of each epidemic within the syndemic, COVID-19 has a high mortality rate and has been a devastating epidemic in the United States. As of January 18th, 2022, there have been over 850,000 COVID-19 deaths in the United States alone. There's a confusion around the messaging. The data is not consistent, it is not clear, and there's plenty of misinformation being spread. And ultimately, due to the pandemic's impact on the community and the way to address this has been prolonged over years, there has been increased isolation and greater loneliness. When looking at opioids or the opioid use disease epidemic, there's increased misuse since COVID-19. There was a 46% increase in overdoses after 3 months of stay-at-home orders and 71% increase of at-the-scene overdose deaths since COVID-19 stay-at-home orders. Illicit fentanyl is increasing, and the epidemic is now driven by illicit fentanyl analogs, methamphetamine, and cocaine, rather than prescription drugs alone. Finally, racism and systemic racism has been a pervasive epidemic in the United States, and because of racism, there are individual groups that have had increased exposure to COVID-19, mainly because essential workers are primarily BIPOC populations. Individuals that are Black, Indigenous, or people of color also face medical racism, and there are disparities in proper diagnosis and treatment of BIPOC patients. And systemic racism does lead to death. Black people account for 39% of COVID-19 related deaths, yet they only make up 15% of the general population. Now, the oral disease epidemic is also influenced by these. For COVID-19, one's oral health influences the severity of COVID-19. Those with periodontal disease, they're more likely to develop hospital-acquired pneumonia or complications. So if one has oral disease, then COVID-19 can have a more severe impact on the body. Now, while dental overprescribing was a key contributor to opioid misuse before 2019, data has shown that has largely decreased, yet emergency visits due to dental pain continue and they lead to increased mismanagement of pain and disease. And finally, but definitely not least, an overarching issue in the social determinants of health is systemic racism, and it does impact oral health. There are a number of reasons how systemic racism impacts oral health and oral disease prevention and oral care access. However, through physiological outcomes of those discriminated against, it directly impacts their oral health. There's an undermining of dental health service provider-patient relationships, and that's under additional stress with the pandemic. And veterans are vulnerable within all of these overarching groups. So we have the COR syndemic, we have oral disease, especially impacting vulnerable populations, and veterans are unfortunately being impacted greatly. As of November 2021, there were 16,800 VA COVID-19 deaths, but overall veterans have increased risk factors for COVID-19. However, they do have a decreased mortality when compared to the general population, which is showing there's something working in terms of care access. However, opioid misuse has increased, especially in veterans as well, since the start of the pandemic. VA researchers found that 16.6% of dental visits did result in persistent opioid use, and veteran age adjusted overdose mortality increased 23.7% from 2010 to 2015. And data, while we don't have the exact numbers, has shown that there has been an increase in all overdose mortality since 2015, especially since 2019. It keeps going up, and veterans are included in that population. And finally, military veterans of color, they're at risk of developing adverse psychological outcomes at higher rates than their white counterparts, and race-related stressors and PTSD in veterans are positively correlated. Now, the CareQuest Institute for Oral Health and the American Institute of Dental Public Health released a white paper focused on veteran oral health to expand access and equity. I have a QR code that you can scan to take you to the white paper on the screen. And there were 3 recommendations that really stood out to me. One was about breaking the silo. Veterans, like all Americans, they experience a siloed system of care, and that's not effective, especially when we have a syndemic context and things are interacting. We need to break these silos of care. We also need to increase trauma-informed care to improve the quality of care. We need to prioritize trauma-informed approaches to clinical care and support minimally invasive and integrated oral health care, while also deploying multidisciplinary care teams to facilitate whole person care. And finally, we need public data. As you saw in some previous slides, we have some data regarding overdose deaths or individuals that are able to access care, but a lot of the data is still fragmented, it's not available, and we need veteran health programs to be able to overcome the challenges that examine oral health outcomes, and data can help with that. So how can oral health leaders take action on these 3 items while also addressing the syndemic? So to first think of COVID-19, if you're able to participate in a COVID-19 vaccination clinic or are able to participate in supporting vaccination, do so. And support disease prevention, such as dental sealants and fluoride treatments. Part of trauma-informed care is also supporting disease prevention strategies. In order to address opioids, dental teams can be connected with an emergency department and addiction clinic. This can avoid an inappropriate treatment of disease. Dental offices can also include fentanyl testing strips in their dental offices and have them available for their patients to take if they need. The more accessible these strips are, the more we can potentially help communities have them. And finally, with public data, while data may not be an area of your own collection as a professional, you can participate in mentorship programs that offer pathways to historically excluded groups. And part of public data is also public support and making sure individuals' voices are heard. This is a part of community-based participatory research, but also your ability to uplift historically excluded groups. And while that mentorship can also address systemic racism, so can your mission to be actively anti-racist and address the social determinants of health through your work and data. Learn the individuals in your community and the barriers that they face outside of the dental office as well, because it can impact their oral health. The references for this presentation are on the screen. And thank you for your time. The QR code on the screen is to my contact information if you have any questions. A special thank you to Dr. Annalise Cothran of AIDPH for her steadfast oral public health mentorship and leadership.